Thank you for participating in the Children's Care Network Obesity Prevention and Treatment Quality Initiative. The initiative includes 3 basic elements: evaluation, treatment, and education. These elements are important features of all well child visits. Our goal is to encourage wellness and healthy habits for all children to prevent and treat childhood obesity. Through collaborative efforts of TCCN-affiliated primary care and subspecialty practices, we created the following evaluation and treatment protocols. These protocols are in accordance with the American Academy of Pediatrics guidelines for physical exams at well child visits. All patients should receive counseling on obesity prevention messaging, which will be provided at each well visit for children ages 2 to 18. These healthy habits are eat more fruits and vegetables, limit eating out, drink more water and limit sweet drinks, more active play, and less screen time. All patients, regardless of BMI, will be encouraged to establish a wellness goal. The physician will document BMI percentile and blood pressure for children over the age of 3. The Children's Care Network advocates the incorporation of all these recommendations into the care of all well visits. There are 4 key components to the Obesity Prevention and Treatment Quality Initiative, which will be implemented in steps. They are: collect and document BMI percentile and code appropriately, counsel and code for diet surveillance and exercise counseling for all kids, order appropriate labs, and set and document a wellness goal for all patients. Our initial intervention and network requirement is appropriate coding for BMI percentile for all patients 2 to 18 years of age. The documentation and coding of BMI percentile is important for us to capture the prevalence of overweight and obesity in our network population. Now let's see how Dr. Evans demonstrates what this looks like in practice setting. Please note, you will see her using Strong for Life tools to facilitate her counseling. These tools are not mandated by the TCCN, but are available free for your use. Other evidence-based tools also exist. Please use what works best for your office.
So let's talk about how Kellen has grown over the past year.
Yeah, sure.
On his weight, he's gained about 5 pounds over the past year, and he's grown about 3.5 inches. So awesome growth over the past year. One of the things that we look at to see how Kellen's grown over the past year is to look at what's called the BMI or body mass index. So that compares his weight and his height for his age. Right now, Kellen's at the 80th percentile. That puts him in the green zone, and that's really where I want to keep him. So great job at growing, Kellen. High five. Let's talk about the healthy habits assessment that you filled out. So Kellen, tell me what your favorite fruit to eat is. Let me guess. Strawberries.
Strawberries.
Oh, how did I know? That's awesome. I want you to keep eating those strawberries. It's going to help make you big and strong. What vegetable do you like to eat? Like green beans or carrots, broccoli? Just pick one for me. Green beans. So what I want you to do is keep working on offering those fruits and vegetables that he seems to like the most, and then we'll keep working on introducing new ones for him. Right now we're at 1 to 2 times a day, so we'll keep working on increasing that.
Okay.
And then as far as activity, Kellen, are you being active for an hour every day? You're super active. Keep up the good job. Awesome.
Yeah, he loves to play.
So that part we want to continue because, again, it's going to just help with keeping him healthy. Now, I see here you put on here that he's doing more than 3 sugary drinks a day. Tell me about that.
Juice is really the thing that he's having more than any other sweet drink, and he does get that at school. You get juice at school, right?
So did you have a question about number of servings a day?
I think he gets it twice at school, and then he'll often ask for juice when we're home for dinner or for an afternoon snack.
Yeah. So ideally, let's work towards doing once a day.
Okay.
So that would ultimately be my goal for him. Again, remembering that water and low-fat milk should be his main sources of fluid. Okay. But why don't we work on first maybe dropping him down to twice a day? Do you think that would be a reasonable goal for him?
Yeah,
Awesome.
we can do that.
Okay. All right.
we can do
Okay.
that.
And TV time, it looks like he's doing 1 to 2 hours of TV a day, which again, if he's staying active, we're keeping things balanced.
Yeah.
So why don't we plan that for now? Our goal is going to be for us to do more water and limit our sugary drinks. Do you think you could do that for me, Kellen? Awesome. This again is some of the things that we've talked about and the things that you guys are already doing. We're going to let our goal be to increase his water intake and limit those sugary drinks.
Okay. Sounds good.
It's easy to incorporate obesity prevention and treatment counseling cues into your electronic medical record. For example, your nurse or medical assistant would enter the patient's height and weight into your EMR. The EMR would then calculate body mass index. In addition, your nurse or assistant would enter in the patient's and parents' answers to the Healthy Habits Assessment questionnaire. When I walk in the room, that then allows me to go over with the parent the BMI percent and where that falls on the chart. And it also allows me to review their answers to the Healthy Habits Assessment. I can then use those answers for targeted counseling and for working on goals for the future. Coding for BMI can be a simple process. Entering the ICD-10 codes will populate the Population Health Management tool and eliminate the need for a time-consuming chart audit. In addition, it's a reporting requirement for the Georgia Medicaid CMOs. This process improvement allows the Children's Care Network to identify patients who meet the BMI criteria for prevention and intervention strategies, as well as track the effectiveness of these programs over time. Many practices have already incorporated the documentation and utilization of BMI percentile into their patient care and lack only a mechanism for coding. The tool will determine BMI percentage documentation rate. BMI percentage will need to be billed in the practice management system using the different ICD-10 codes. We recommend talking with your individual practice management system and electronic medical records vendor to include these codes into your billing system. These codes may be incorporated directly into the record when calculated by some EHR system. Alternatively, they may be added by medical assistants or nurses at the time of documentation of vitals, by the provider at the point of care, or inserted by coders and billers in a front office setting.
You can see how these simple steps related to BMI percentile documentation and coding can be incorporated into your well child care to prevent and treat childhood obesity. As I mentioned earlier, dietary surveillance and exercise counseling, labs, and goal setting will be phased in as part of this quality initiative. TCCN will be advocating on behalf of our membership to our contracted payers to explain the importance of these counseling methods to combat obesity. We encourage all providers to attend the Strong for Life Provider Training Program to get training and tools to improve the effectiveness of counseling for obesity prevention and treatment. For more information or to sign up for a training, please visit strongforlife.com/provider. On behalf of TCCN, I would like to thank you for participating in the Children's Care Network Obesity Prevention and Treatment Quality Initiative.